Hello and welcome. I am Dr. Mia, straight from the gut. In this video, we're going to discuss about fatty liver, a real-life doctor-patient conversation. For the first time, a lady is presenting to me with fatty liver, and in this video, you'll learn what to do, what we think as doctors when somebody has a fatty liver, how to work it up, what are the risks of fatty liver, and why it should be treated and how it should be treated. So stay with me. It'll be an interesting conversation. Okay, so when you are asking about fatty liver, what fatty liver means, there is excessive amount of fat in the liver, okay? Normal liver, you have seen animal liver, what color it is deep maroon or deep brown in color, okay? As the fat accumulates, it becomes a lot more flabby, and sometimes the liver test, or what you call liver function test, becomes abnormal. The reason being these fat cells, they irritate the liver cells, and liver cells gets damaged, they get destroyed, and they release enzyme. That's why our liver function test becomes abnormal. Okay, now fatty liver is not one specific disease. A variety of things can cause fatty liver, starting from metabolic problem like overweight, genetic problem that we call syndrome X that comes with diabetes, sugar disease, overweightness, other metabolic problem. They also give rise to fatty liver. It is believed that it's a genetic inheritance. And oftentimes, even if you don't have diabetes, your family may have diabetes history. Do you have diabetes?
Yes.
Okay, so you have diabetes. Do you have a family history of diabetes?
Yes.
Do you have a family history of any liver disease?
Not that I know.
Okay, sometimes also these kind of liver diseases, the fatty liver can also go from family to family. In fact, I have a family who has all three daughters, and the mother has fatty liver, and they have also strong history of liver cirrhosis and liver cancer. Okay, now it is very important for us to find out what causes fatty liver. As I said, fatty liver is not a disease by itself, but it's a manifestation of a disease. If it is due to overweight, if it is due to poorly controlled diabetes, then that needs to be controlled. On the other hand, one of the common causes of fatty liver in our nation, in the United States, is also alcohol drinking. Now, so that's why it could be alcoholic fatty liver. But in your case, I'm assuming you don't drink any alcohol. So it is called non-alcoholic fatty liver disease. So now, again, that is not one disease. So sometimes if you have systemic inflammation in other part of your body, you can have fatty liver. Some medications can cause fatty liver. Autoimmune diseases initially can cause fatty liver before really the liver fails or people develop cirrhosis, those kind of problem. Hepatitis A, B, C, D, or E, and nowadays even up to H, they can also cause fatty liver. So we have to be very discerning. We have to carefully do the work. Now, autoimmune liver disease that causes fatty liver is more common in middle-aged females. So especially in female, it should be a trigger factor in our mind to work it out, okay? In addition to that, other metabolic disease like genetic disease, metabolic disease like initially hemochromatosis or Wilson's disease, which is a copper metabolism problem, can also give rise to this. Sometimes rapid weight loss or even rapid weight gain can give rise to this. Certain amount of diet can also give you fatty liver, like people go to different diet fashion or fads, like sudden weight loss or high protein diet or say caveman diet, they can also give rise to fatty liver. Okay, so we have to be carefully, we have to work it out. As I said, there is not a single one cause that causes fatty liver. So I'm going to do a whole bunch of blood tests, as well as, of course, I have done your physical exam, so I know what you have physically, and then we are going to go work it out. Sometimes early cirrhosis, before cirrhosis gets really established, early cirrhosis can also present in the way of fatty liver, and liver becomes enlarged. Now, what's the reason we need to work out fatty liver? Here is the reason. Because fatty liver, as I said, causes, let's look at this picture, causes chronic irritation of your liver. Due to chronic irritation, each time your liver cells damage, liver cells are very specialized cells. They're called hepatocytes. They perform very special function. In fact, liver does so many functions that the most complicated chemical factory of the world will not even match with 1% of the complexities of the liver. It is the main metabolic organ. It is the main detoxifying organ. It is the main area for protein synthesis in our body, processing the carbohydrate, processing even glucose, processing fat, processing protein, you name it. Liver is very, very important organ. That's why liver has actually two different blood supply as opposed to any other organ. Liver gets its blood supply from two different organs because our body knows, nature knows, or if you believe in God, God knows that it's such an important organ. So it has double blood supply. So that's the reason. So now, due to the fatty liver, the fat cells irritate the liver. And as I said, then liver cells die and they release those enzymes sometimes. And you will see that in the way that liver enzymes have gone up. If you let it go, then slowly each cell that dies will be replaced with scar cells. And scar cells are not hepatocytes. They are not specialized liver cells. As a result, liver will not be able to perform its function. And so a cirrhotic liver looks like that nodule. A normal liver will be very smooth and deep brown or almost maroonish in color like this one shows. However, once they become fatty liver, they will become yellowish, big and saggy. Normally, this one is firm feeling, but this one will have a saggy feeling. And cirrhotic liver looks like there are lots of hundreds of nodules, like little scar nodules, okay? And then if it goes unabated, of course, if the whole liver becomes cirrhotic, then you will suffer from the complication of cirrhosis. But once you have excessive scarring, that is also a stimulus for liver cancer. So people can form fatty liver tend to have higher amount of liver cancer. Therefore, it is imperative that we work up fatty liver and we specifically address the underlying issues. And treatment of fatty liver is treatment of the underlying disease. Like people who have alcoholic fatty liver, they need to stop alcohol. If you're overweight, you need to lose weight. And the encouraging news is that if you just lose like 5-10% of your weight, you don't have to lose a whole lot. Fatty liver reverses itself. And another good news is that fatty liver is a reversible disease. It's not an irreversible. If you have diabetes, there should be better control. If you have other kind of disease that needs to be addressed appropriately, then fatty liver will automatically reverse. So is the good old cliche, good old principle, if you pull the ear, the head will come with that. So that's how we treat fatty liver. So in your case, I'm going to start out with a whole bunch of blood tests. As I said, it will be a full panel of blood tests. Some of them are not usual, so it may take longer time to come back, and I'll see you in 2 weeks. In addition to that, because liver is an internal organ, we can just from outside feel to a certain extent, but we really do not know what is going on inside. So I'm going to have a method of looking at it. Ultrasound will be a good way to go by, but if ultrasound gives me any trigger factor, I may do MRI or CT scan or all of this stuff. So this is how we're going to work up on fatty liver. Okay, is that clear to you, ma'am?
Yes, sir.
Do you have any other question or concern?
No.
Okay, so we are going to finish the video right here, and I'm going to put the order for my patient, and hopefully all of you who are checking my channel will also learn about this. If you have any question, also please feel free to address the question in the comment part. I will be more than happy to answer you. I have a favor to ask from you. If you had enjoyed this real life conversation, undoctored, unedited conversation, and if it has benefited you, please help me by pressing the like button and subscribing to me so I can in future bring you more and more of this real life conversation, real patient-doctor conversation. Have a great day. Thank you.